So much of what we rely on has fallen away. Everything about life has become more challenging and difficult. We've all had to make sure that we're looking out for each other, not leaving people behind.
Adult female code red.
Head-on collision, 80 miles an hour.
Hit and run, cardiac arrest.
I can't feel a pulse. Start chest compressions. Mark. Chest patient. Mark.
We have a pulse. How'd you like your tea?
2 sugars.
2 sugars.
St George's, London.
Doing really, really well.
One of Britain's busiest A&E departments.
Are you able to come now? CT is ready for us.
It's gone mental in here.
Officially full in resus.
Who's the most famous person you've met?
Sinatra.
Really?
It's fun.
A place where life,
I just love doctors.
love,
I'm a lucky girl to have you.
and loss
Just say goodbye to your family, OK?
unfold every single day.
In A&E, whether it's patients or the people that I work with, I see ordinary people doing extraordinary things.
Well done.
Thank you. Thank you very much.
Filmed across one 24-hour period, these are the stories of a nation and its health service.
So sorry.
Why are you sorry? This is literally the reason we're here.
When faced with pain, when faced with hurt, people's innate desire is to stand by one another.
I miss you. I'm worried I'll never see you again.
Oh, sweetheart.
Time and time again, day after day, people choose to love.
You're in safe hands. You're all good. All right, darling?
Life is full of setbacks. The ones that hit you hardest are unforeseen, and you're totally unprepared for what is coming next. As a trauma surgeon, what we do is about restoring function, improving pain. It's about getting people back on their feet again. Okay, you're in a safe place. Part of your role is not just managing the physical injury, but supporting them through the mental toll that major trauma can bring. It's not just a fracture in front of you, it's a patient, it's a person. And being able to help someone through the darkest parts of their life and out to the other end is one of the wonderful parts of the job.
Hello, St George's. Major trauma? Yep. Okay then. Thank you. Bye. Paediatric major trauma call, 10 minutes. Car versus the child.
Paramedics are rushing an 11-year-old girl to St George's after she was struck by a car. Dr. James is on call in the emergency department.
The paediatric trauma calls can be some of the most difficult to deal with, both in terms of the injuries, but also emotionally.
11-year-old RTA, shoulder.
It's not just the child that you're going to be treating and talking to, but you're also going to be talking to the parents who themselves are going to be scared and anxious and worried.
It's 11. Do you want to do primary?
Yeah, sure.
Is that all right?
Yeah. Being a new dad, you can only begin to think how stressful being in that environment is.
The girl's mother is travelling with her in the ambulance.
Shanti loves school. She was rushing around because she doesn't want to be late. She doesn't ever want to get told off. I waved to her through the window and I was like, hurry up. So she's run off down the street. And then probably 10 minutes later, I got a call and I've just ran down the road. I kind of ran, and then I stopped. She was lying in the road, not moving, not moving.
That's all right. Come on, darling. I'm Reese. I'm one of the consultants. Are you Mum?
Yeah.
Come with me, come with me, come with me. Come in, Mum. Come.
My heart literally left me.
Well done, well done. Excellent.
This is Ashante, 11 years old. Ashante was on her way to school today. Was running because she was a bit late. Cars slowed down, let a few people across. Sped up again because she hadn't seen anyone else. And Ashante's run across the road. So it was about 20 miles an hour, the crash. There was a bullseye to the window screen, but it was her shoulder. Ashante remembers it being her shoulder. No loss of consciousness.
Thank you.
Do you want to get them off the scoop?
I'll get off the scoop.
Steady.
Well done, well done, well done.
Ashante, hi, I'm James. I'm one of the trauma doctors. Everyone's here just looking after you, OK? I'm just going to need to have a quick look at you just to check where you've hurt yourself, all right? OK, airways patent. She's in a hard collar currently. Trachea is central. My role is to find where the life-threatening injuries may be. Big breath in for me. And out. You're under a lot of pressure to make sure that you don't make mistakes because it's known that children can go downhill so quickly. Any pain in your tummy? There. A little bit of pain there. Right upper quadrant pain. The life-threatening injuries are often within the chest or in the abdomen. Air entry is very mildly reduced on the right side compared to the left. She might have broken a couple of ribs as well.
OK.
A sign of rib fracture might mean that they've got a collapsed lung or they've been bleeding into their chest, and that can be life-threatening.
Sorry, you're doing well, sorry.
I was just fearing the worst. How many more times are we going to go to the hospital for Shan? She's been through enough.
One day I had a peppermint in my mouth, and I was talking to someone because we didn't have the glass then.
Yeah.
And as I was talking, the peppermint flew out of my mouth and landed on the floor. I was so embarrassed.
Oh, thank you. Which one have you done?
Mate, my Achilles went. Had to go, pow. I just went down, mate.
Screamed?
Nah, mate.
Nah, I firmed it.
Firmed it, I had to. I sound like boots hitting each other. So I turn around, yeah, no one's there.
No one's around you.
I've looked down, and I was just like, yeah, mate. I was like, mate, get me off, I'm done.
Yeah.
I haven't played for years. I used to play at a decent level. I always took football seriously. I was always one of the best footballers in the kind of the local kind of area. Haven't played for about 4 years. Got back in it. Injury. This. Done. However, we used to go to church on Sundays. So my parents didn't let me play football in the Sunday league, and that's the only place where you can really, you know, you're really going to get anywhere from. So it was only till year 10 where they said, OK, Reese, you can go and play football now. Did you come off straight away?
Oh, yeah, I rolled off.
So I did 1 year at Tooting and Mitcham. My first season, scored loads of goals, was looked at here and there by different clubs, got scouted by Crystal Palace.
Yeah, that's you done, isn't it? Yeah, you're not trying to do that no more.
I'm not trying to do that at all, mate. I went from playing, obviously, Sunday League. My first game was against Russia, under-16s. All of a sudden, you're in and amongst some of the best players in England. You know, it's an amazing feeling.
There you go, is it Reese?
Yes.
Yeah, do you want to come in?
Now take it easy, man.
Aye.
Best of luck.
Thank you.
All right. I'm Vicky. Nice to meet you. I'm
Nice
one of
to
the
meet you, Vicky.
practitioners. How can we help you?
All right, so I think I've blown my Achilles.
What happened?
Yeah, so I was playing football, turned to run the other way,
Yeah.
put my heel down.
Yeah.
I just heard it,
You heard a pop, did you?
had a bang.
Right, let's have a little look.
So I grew up in South London, in an area called Mitcham.
Yeah, it's got very swollen, hasn't it?
I definitely didn't have a privileged upbringing, that's for sure. For many years, no one in my family worked, so it was just getting through each day, each week, each month, as you can, really.
Is it painful?
Oh, jeez.
I'd take that as a yeah.
But once I'm on the field, once I'm on the training ground, nothing else matters. Which was peaceful, do you know? It was a world from my world, do you know? It was my escape.
Try and push me down with this foot. Lovely. And try this one. Yeah, it doesn't want to go, does it?
Yeah, I did feel disadvantaged in a lot of senses, you know. Some kids would turn up, you know, the dads drove them to training, they got Lucozades, they got boots, they got this, I've literally trudged from South London all the way to East London, you know, with £1 in my pocket, with just like a Snicker, and now I've got to go play against some of the best players in the country.
All right, Tioka. As I say, that mechanism that you said, that big pop, and often people say it sounds like a gunshot kind of.
Yeah,
bang.
that's how I thought I got.
Yeah, well, I hope you didn't get shot on the football pitch.
Oh gosh, I don't know what's going on. But...
Right, you're going to be in plaster.
What? When?
Yeah, I'll put the plaster on for you this evening.
This evening?
Yeah,
plaster?
yeah.
Okay.
All right.
Yeah.
So I know it's not the best news. I'm always the bearer of bad news. Right, are you comfy there for a moment?
Yeah, I'm fine. Unfortunately, I didn't get a pro. Just didn't work out for me. I got released from Crystal Palace, and then I had a choice, you know? What do I do from there? I didn't really know anything else.
All right.
I wasn't focused on school too much. Didn't pass anything in school.
Right, blood time, if that's okay. Can
Yeah.
I borrow your arm?
Yeah. And my teacher at the time, and he said, look, Reece, how about you look into going over to America so you can go to university, at least you can play and still get an education, you could get it paid for you.
So Manchester haven't called you up just yet.
Not quite yet, I'm still waiting. Leaving family is always going to be hard. However, the opportunity was bigger than that. There's no limit to what I can do out there. As soon as I heard it, as soon as he presented it to me, I was on it.
There we go. If you hold that on there for me.
And then the offers just started coming in.
There we go.
Right, my lovely lady, I've just got some painkillers for you. They're really strong, and it goes a little bit up each nose. Sounds a bit funny. All right, 1, 2, 3. Good girl.
Doctors are assessing 11-year-old Ashanti for internal injuries after she was hit by a car on her way into school.
There's no indication for CT head, is there? No loss of consciousness. No. Let's do X-ray chest, X-ray pelvis, X-ray neck. Hold her CT abdomen, okay, just to try and reduce radiation.
An X-ray is very good at giving us a quick answer as to whether one of the lungs has collapsed in the chest or whether there's a significant amount of bleeding within the chest cavity.
Okay, X-ray. Okay, sweetheart, can you breathe in for me? Take a big breath in. Good, and breathe normally. Well done.
Ashanti is like a little ball of light, a little ball of extraordinary. She likes to dress funky. She is just an individual and she doesn't care if it's not. I'll be like, Shan, are you really going out in that? And she'll be like, yeah, that's what I want to wear. She wants to be at the top of her class, and I remember her crying because her report didn't have all A's. Like, it was a good report. And I was like, why are you crying? And she's like, because I didn't do as well as I could have done. Well, you'll have stories to tell your grandchildren.
My grandchildren will think I'm insane.
Well.
I am. Why do I always have to do something?
Ashanti's my baby, my third child. Before Ashanti, I lost a baby. When we went for our 3-month scan, it was then that we found out that it didn't survive.
I was in a lot of shock.
So. The distress of losing a baby, and then the fact that you can carry again, there's a excitement and happiness, and then the scared. I'm scared. I panicked throughout my pregnancy with her, like any little thing. I even got induced early because I was just like, I just need to see her. I need to see her. But then when it does come to fruition and you have this baby in your arms, you're gonna feel like $1 million. Clever you, eh? That's a good way to get out of school, isn't it?
All right, lovely lady, we're going to get you round to X-ray now so we can do it of your neck, okay? Sometimes they can do all the X-rays here, but there's some that they just can't. They have to go round to the actual X-ray department.
Okay.
All right, lovely lady.
Okie doke. Come on then, girlfriend. Oh. She was a happy, healthy baby. I didn't see any reason to worry about her. But at 2 years old, something awful happened to Shan. Ashanti basically doubled in size overnight. She just ballooned, so it wasn't fat or anything, it was liquid. Basically, her body had shut down.
Busy day today.
Hello, Georges. Okay, tib fib fracture transfer. Is it an open tib fib fracture? Okay. Thank you. Adult female trauma transfer, ETA 10 minutes.
A 60-year-old woman is being transferred to St George's from another hospital with a serious leg injury after tripping over her cat and falling down the stairs.
It's a tib fib fracture.
Open fractures are one of the most devastating injuries that we see in major trauma. They're high-energy injuries. The force required has made the bone rip through the skin from inside to out. They can certainly be limb and life-threatening to the patient.
So this is Julie. She's a 60-year-old female. At around 2 a.m. last night, she fell down a flight of stairs, injuring her right ankle. Picked up by paramedics, taken to Frimley Park Hospital. She's been treated there and referred to St George's.
Has her C-spine been cleared?
Yeah, clear. Just her ankle.
Okay. Hi. Hi, Julie.
Hello.
My name's James. I'm one of the trauma doctors. You're at St George's.
Yeah.
Okay, so I'm just going to examine you, okay? Is that all right? Where's that hurting? Just everywhere? She's sort of generalised tenderness over the femur. There's no deformity there. Okay, you feel me here, yeah? Wiggle your toes for me. Good stuff. Thank you, Judy. All right. So, yeah, we definitely need an X-ray of her ankle. The greater the wound, the higher the degree of infection. We need to get on it quickly. We'll take good care of you. I'm sure I'll be seeing you again shortly, all right?
Let's go.
In an older person, their healing potential isn't so great, so you know that there's a greater chance that they may have limb-threatening complications further down the line.
Don't worry. Don't worry. We'll be okay. So the trauma and orthopaedic doctors will look at your scan, okay? And then we decide what the next plan is, okay?
Julie is returning from X-ray with an open fracture to her ankle. She has no close family joining her.
So you tripped down some stairs?
Yeah.
Can you remember how that happened?
Yeah, I was stepping over the cat. The cat was lying on the stairs. He's quite a big cat, long one.
Yeah.
So I stepped over and my legs went and I just went straight down. So,
all right.
And there's just blood everywhere in the house. So.
How many stairs do you think you fell down?
I've got 4 cats.
Okay. It's particularly hard when you see someone that comes into hospital who doesn't have someone there.
For about half an hour I had to call help.
Oh, I see, calling out loud.
Yeah,
okay,
yeah.
in the middle of the night.
Yeah.
Oh, poor thing. They're often in pain, they're often scared. And I think my role as a doctor is as much about supporting that patient as treating them. So you got a nasty fracture to your ankle, okay, and it's quite displaced at the moment. And in addition to that, the skin has torn on the inside.
Yeah.
And what I'd like to do is put it in a better position than it is at the moment, because I don't really want to leave it essentially dislocated, okay? So that's what we're going to do. We'll give you some good painkillers, okay? And then we'll put on a slightly better fitting cast, and which will hold it in a better position, probably be a bit more comfortable for you as well.
It's very uncomfortable.
Is that all right?
Yeah, that's fine.
So just be a bit of time just before we get all the cast stuff ready.
Yeah.
Okay?
Yeah.
Any questions for me?
No.
No, okay.
I trust you.
All right.
¿Hacemos una foto?
No, es loco.
Y ahora vemos un amigo de papi que me ayuda. Mira.
Es loco, papi.
¿Pusimos loco?
Right. One bit of bad news for you.
Oh.
No, it's not bad.
Oh.
It's about your trousers.
You got to take them off.
Well...
Yeah, but I have no other choice. I don't have any other clothes in me.
The other option is...
This one, go home in boxers.
26-year-old Reese needs his foot plastering after damaging his Achilles tendon playing football.
It's much easier if you sit up for us. I'm a bit of a messy plasterer, you see. So, all righty.
I never went on holiday. Hearing I'm getting scholarship from this place and that place, it was huge. It was exciting. It was something new. It was something fresh.
We just have to have a little bit at the top and bottom to fold over, all right?
So my first stop was Asheville, North Carolina. Totally different. It's just a different life. All I could hear is crickets. just like this overwhelming noise of crickets, and it was crazy. I don't go to countryside here, do you know? I don't leave London.
So you'll see the end of your toes as well, all right, Sue?
I did a year in North Carolina, and then I went on and moved to done 2 years over in LA. And I straight away hit it off with the coach, amazing guy, amazing team.
If your toes become very, very swollen, you'll need to come back and see us. It just means the plaster's too tight, all right?
It took me a few seasons to really get into it, but now I'm starting to become a lot more intelligent on the field. My touch is better. So now I'm at my prime. Our team then went from 108th in America to then my first season there, we ended up 4th.
There we go.
I was doing extremely well football-wise. I was doing pretty well academic-wise. However, I think it was like a 90% scholarship, so I still had to come up with 10% of the annual tuition, about 4 or 5 grand each year, which just accumulated over time.
Here comes the slightly messy bit. As I say, I'll try not to get any on you as best I can. It does come off, though, if I do, all right?
No worries.
Right, you ready?
Yep.
It's a nice warm plaster.
You just couldn't afford to be paying all these different things out. I'm working 3, 4 different jobs just to keep the food in my mouth, keep the heating on, keep electricity on.
So if you keep your knee still for me, I know sorry.
And there wasn't no support coming from home because they're going through their own problems, so it was literally just me and that's it.
Sorry.
And they said, look, we need X amount from you for us to move you into your senior year. I didn't have that. So unfortunately, I had to come home.
I don't mean to cause people lots of pain, sorry.
I was devastated. That was more devastating than not signing pro. I haven't been in London for like 3, 4 years at this point. Now I'm just coming back with a bag and that's it. Going back to the same position that I was, probably worse.
Can I borrow your finger?
Yeah.
Just on there. Perfect, thank you.
I would say I'm mentally strong in a lot of senses. That pushed me right to the edge. That pushed me right to the edge.
Things you do, eh?
I'm pretty sure I've just seen Sam cleaning up leaves. OK, no, I wasn't imagining it. No.
That's it.
Hello. Julie.
Yes.
My name's Sonel. I'm another one of the doctors. I'm one of the consultants here.
Mm-hmm.
We are going to give you something to sedate you a bit, just so we can get your ankle into a good position.
Yes, it's really painful.
Yeah. Can I ask, have you got all your own teeth?
Yes, but they had 2 of them fell out at Christmas.
OK.
So that's all I wanted for Christmas was the 2 front teeth.
What will be my punishment?
Your punishment? Cookie dough ice cream. And lots of cuddles. Mm-hmm.
Doctors now have the full assessment of Ashanti's x-rays.
So it's all looking good, OK, from the point of view of your neck, chest, pelvis. So that's all really reassuring. You've broken your arm just around here, OK? So what we're going to do is we're going to sit you up nice and gently, OK? And then I'm going to put a what we call a collar and cuff, and then we'll be good, OK?
Okay, we're going to give you some Entonox, happy gas, all right? Okay, so you just suck on it.
You'll find this to be a bit of a laugh. Take you to a happy place. What we often do is realign that fracture. And the sling's great because once you've done the first realignment, gravity then takes over. Have you ever had a...
So you suck in, breathe in.
Entonox before?
Oh, well, I've got 3 kids.
There you go.
There you
Okay, just breathe normally.
Right, ready, Ashanti?
Big breath in.
Can we just put this down?
Yeah, of course. Okay. And I'm just going to slowly sit you up.
Ashanti went from a normal child to this other child, double the size, and it was like something's definitely wrong.
Big breath in. Big breath in.
All right, deep breath, Shan. And so I'd gone to the doctors. When they did the blood test, they said, oh, it's going to be a while. You can either go home. We wasn't far from the hospital, and we'll just give you a call.
Lift your bottom up.
Can you sit up a little bit?
Right, ready?
So then we get a call a couple of hours later saying, bring her back now.
Try and push yourself up.
Push yourself
Ashanti,
up. Sit up.
Look at me, darling. Ashanti.
Shan?
Okay.
Her kidney function had gone wrong and it wasn't processing her urine as it should do. And her blood pressure shot through the roof, dangerously so. I just had overwhelming panic.
On 3. 1, 2.
Push it up. All right.
There we go.
It's okay. It's all right,
Okay.
Shan.
You're doing all right. You okay?
Shan? Shanti?
Ashanti. Hello.
Shan, it's okay. It took literally 2 weeks to stabilise her.
Now you can put your knees back down if you want.
Take the gas in there if you want more. She was then on a massive amount of steroids to control this thing. It's okay, Shan. Keep breathing. It was a whirlwind from one day your life is okay and to the next we're in hospital with this unknown disease that how do you fix it? Keep breathing, Shan. Every day was a blood test. And then we found out it's nephrotic syndrome, which I'd never heard of before.
Okay, right. So I know it's difficult, but what we want is for this to hang down. So we just need to let gravity take its course and it straightens up. All right? Is that okay?
Nephrotic syndrome is the kidney function doesn't work. So the body starts to swell up and it starts affecting all the organs, not just the kidney. It affects everything, so the body starts to shut down. And there is no fix. They don't have a cure. Oh, no. It's broken, baby. It's broken, sweetheart. It's going to take a while to mend.
Having the parent there to be with the child and to support them is often more important than any painkiller that we can give them. So if you want to, could you just request a shoulder x-ray? I'll just get this ankle dislocation. When you have a child, all you want to do is support your family and do the best that you can. Right, so.
Julie has been sedated so that Dr. James can now realign her fractured ankle.
So much pain in my ankle.
Yeah, it would feel quite a bit better once we've put it back in joint.
Oh.
On the day before lockdown, my first child was born, a healthy baby boy at St George's. I couldn't have been more happy in my role as a new dad when, at the same time, the rest of the country seemed to be falling apart.
All right, Julie, we're just taking off the bandage, OK?
Everyone that could help was also needed in hospital. So after my paternity leave, I cut short the extra leave that I could take to get back to hospital. And this was really hard because my wife had recently had significant surgery and was still having trouble walking. So you can see the pressure. Yeah. And this can become necrotic. My son was only 3 weeks old, and I knew that I was going back into hospital treating some of the most ill and most infectious patients in the hospital. You'd never forgive yourself if something happened to your new child or to your wife who's recovering from surgery. Oh, stop. Quite a nasty cut. I'll potentially be a risk to those I love the most. So together we made one of the most difficult decisions of our lives. I would move out. Stay with that one, then gently feel it clunk back in. That's it.
Squeeze my hand, darling. Squeeze my hand. Try and keep that leg nice and still. Okay.
They put a sign in the window saying, come home soon, Daddy.
Deep breath. Deep breath. Just hold
okay, Julie,
for 1 second. Deep breath.
And we could speak to each other over video conferencing and things like that, but it's not the same. And then maybe get one more over the bottom there. All I wanted to do was hold them. Okay, that's about right, so just tear that off. Good man. Those weeks were some of the most difficult and lonely in my life. One last bit. Okay. Good. Okay.
So here comes the fun little bit. We have to start you on some blood thinning now.
Okay.
They're injections, sadly.
Oh.
So it comes like this, okay? So the syringe is all in here. It's all pre-filled, so you don't need to draw any medication out, okay?
Reese needs blood-thinning injections to reduce the risk of a blood clot following a tear to his Achilles.
Are you happy to do it yourself?
No, not at all.
How are you going to do it at home?
Well,
do you want me to do it?
yeah, if you can do this one.
Do the first one.
And then you just point out to me what I'm doing.
Yeah.
While I was away, my family went through some financial difficulties, which led to them being evicted.
It's subcutaneous, so that just means it goes into the fat, basically.
Coming back from LA, hadn't lost the scholarship. I was homeless, didn't really have anywhere to go, sleeping on my friend's couch.
If you bring your tummy up, so you squeeze your tummy.
That's the time I started doubting myself and my ability. It really did take a lot out of me, you know.
So, ready, sharp scratch. That's it.
Oh, is that it?
That's it, and then just slowly push it in.
A job opportunity presented itself in an estate agent's in Borough. Went down there, got the job, he loved me, and then it started picking up from there.
And then come out.
At that point, I didn't have a suit or anything like that, so I had to kind of, you know, throw some things together.
And then you can pop that, push that in there.
Then I started to get back into the motion again. You're working, you're then active, you're then thinking how to improve, how to better yourself.
You might get a little bit of bleeding just because obviously you poked something.
From the first job, I moved into a bigger estate agency, one of the biggest in London, where I'd done really well, started to hone in on my skills.
Remember, you've done it on the right side tonight, so tomorrow, left side.
I then came across a lot of developers and we would have talks, and that actually opened my eyes up to the world of finance. I actually realised there's a space where I can actually propel further than I am in just property alone.
So these are yours to take home.
A lady that I was put in touch with said, if you want to do this, then you need the investment management certificate.
Here's your bag.
Thank you.
You put your bag of goodies in there.
She gave me the books and she said, look, go ahead and try learn it. I opened up the books and I said, this isn't for me. Because there's equations and numbers that I never thought I'd be able to understand. Studying every single night. As soon as I finished work at 8 o'clock, I then study every day for about 7 months. The exam itself was extremely tough. A lot of people don't pass it in the first time, so I honestly thought I'd failed.
Don't say we never give you anything. See how you go with those.
Yeah, these feel a lot more
They feel a bit,
tighter.
yeah?
Yeah, these are good. Good thing about this exam is they actually give you your result the moment you walk out of the exam. So I took the letter and I ran off. Literally, I just ran out. I didn't even look at it. I thought I failed.
Right, let me find you a chair. Give me 1 second.
Took it around the corner and it said pass, and I literally broke down in tears. I he just took so much out of me. To be able to pass something like this, probably the best moment of my life.
There you go.
So for me, that was just proof that I can do it. I just have to apply the same energy.
You in?
Yeah.
Yeah.
Life is just a game, and football's a great way to express that, because all the lessons that you learn in football, it's just exactly the same thing that I've learned in life. Nothing ever comes easy, so it's always going to be a struggle. These hurdles, these things that I come across are players, and this is how I'm going to beat them.
And I'll pop you outside. Got everything?
Yep, that's it.
Right.
Yeah, we've spoken to all day.
You've got to get up, young lady.
Okay, sit you upright. Don't forget to breathe. Breathe in through your nose, out through your mouth, yeah? Okay? I'll do it on your count. Gonna go a bit lower. Okay, I'm just here for a little bit of support. Use those core muscles, yeah? 1, 2, 3.
The disease that Ashanti has, there's children who are having to have kidney transplants because their kidney just doesn't function anymore. And then dialysis and all this kind of stuff, the worst case scenarios of what's happening.
Ready? 1, 2, 3.
Oh.
Okay.
You don't quite know what's ahead, how much damage has been done to the kidney. What's the future like for her? Is it shortening her life? Is it giving her other complications? You worry all the time.
Right, just get your bottom round a bit more. Okay.
Fortunately, it doesn't restrict her too much from doing everyday things. She's still the norm.
Okay, can you do it?
The poking and the prodding and the different things and the blood tests all the time. It's just like a process. She knows it's got to be done, but she's so brave. I don't know, I tell her all the time, like, I don't know how you do it, because she's just normal Shan. I would have to take my hat off to her. I really do.
Put your bottom in, okay? And just let your arm hang. Okay.
The good thing is that they said that most children grow out of it in their teenage years. But it's not guaranteed that that will happen. My hope is that it does. My hope is that she's going to get better.
Thank God that you're all right and it wasn't as bad as we predicted it to be.
I'm very strong.
You are indeed. You're my brave girl.
There's a place in Ghana where they have the Ashanti tribe, and Ashanti means queen warrior, and that's why we called Ashanti Ashanti. The name is fitting for her. It's almost like that's what she should have been called because of her journey that she's been on. And she is a warrior and she is a queen, so, you know, there we have it.
Hiya. How are you?
Okay.
Bit more comfortable now? Yeah? Good. X-ray's looking in a much nicer position now.
Good.
So that's really good. Children's bones have remarkable ability to heal. In the long term, this shouldn't cause you any trouble, all right? Bit sleepy still. You've been through a lot today. All right, great. Well, we're here if you need us.
Thank you very
all right,
much.
all the best. I'll ask the guys in front.
Brilliant, thank you.
Those weeks being apart from my wife and child seemed like an eternity.
Ready, Julie?
Ready? Let's go.
Ringing the doorbell of your own home and hugging your wife and your little boy after being away and being in such difficult environment was mind-blowing. It was wonderful to be back. We've all been through so many things this last year. I've never had such highs and lows. We'll look back and go, we've lived through this, and the best is yet to come.
feel fortunate that I've healed very quickly, you know, because if I'd been any older, then it would have been even worse. And I was very happy the way I was treated. Luckily, my mate had a key. She came round and fed the cats for me, so they were fine. And I'm very careful on the stairs now.
Regards to football, that's pretty much me done. It played its part. It taught me a lot of lessons that I've taken with me, and I won't be playing competitive football anytime soon. Well, the odd five-a-side maybe.
It was hard for her to adjust. She couldn't do anything for herself. It was all bathing her again. We was back at baby stage again. Watching her in pain was awful.
School is important because when I'm older, I want to be an interior designer. I think if I really try hard, I'll be able to become one.